South Africa is a country with a dire shortage of hematologists, hematological support, advocacy and services. As the only dedicated hematological services NGO in the country, the Igazi Foundation lobbies provincial and national government to improve existing hematological services and facilities for patients, their families and their supporters. Born in the Eastern Cape in 2010, the foundation has grown to become nationally and internationally recognized as the champion of hematology issues in the broader struggle for better healthcare services in South Africa. Igazi's activities take a holistic approach to blood diseases, dealing with all aspects of these diseases, including where they are treated, who treats them, and the impact of the treatment on the patients and their supporters. All this is within the broader community with significant involvement across all areas through a dedicated volunteer base. Major initiatives in the past 5 years include the successful establishment of the Elo Igazi Hematological Stem Cell Unit in 2013, the Elo Igazi Pediatric Hematology Unit and the ICCF Nurses Lounge and Education Center, both in 2015. At Port Elizabeth Provincial Hospital, our ward wellness project supports these units, including the doctors, nurses, and general assistants needs, as well as many of the general requirements, equipment, and maintenance. Even our new LifeBox program is addressing the nutritional needs of our patients while they are undergoing treatment. Our national GP symposiums, the HDTO, Hematological Diagnosis and Treatment Options, has to date trained 470 medical practitioners in the latest medical advances in hematology, improving the availability and level of hematological care nationally. The NNHF, Novo Nordisk Hemophilia Foundation in Switzerland, has chosen Igazi for the last 3 years to implement hemophilia services and education throughout the Eastern Cape. This project, now in its 3rd and final year, has spread treatment skills in treating blood clotting disorders throughout the Eastern Cape, particularly in rural areas. Our LIVES project, which is leukemia incidence, vital environmental studies, continues to investigate the causes of cancer in this province through environmental studies and consultation. Recently, air sampling and borehole sampling have begun in Port Elizabeth, particularly in heavily polluted areas that many of our patients come from. Our latest venture and our last major objective is Marrow Masakan. Currently, there are only 4,000 black donors of a total of 68,000 donors on the South African Bone Marrow Registry. This project is to encourage more black people to donate bone marrow in order to address this imbalance. On our first test day, 18 July 2015, we were able to test 26 donors and recruit 41 applicants. 67 in one day, also coincidentally Nelson Mandela Day, which is surely good omen. Igazi aims to double the number of black donors in the next few years. The Igazi Foundation's success is the public's success. Igazi's important message of ordinary people working together, creating something extraordinary, has been able to mobilize people power in order to change the status quo of health services. People with strength and determination to effect changes through lobbying, giving of their time, spreading awareness, doing studies, donating resources, finance, and bone marrow in order to create a better health environment for the future. These are the beautiful people Igazi salutes, the beautiful people in this province who even in recessionary times continue to support the work of Igazi. And remember the Igazi Foundation, our blood, our future.